So let's discuss pharmacy data. Hospitals and retail pharmacies use National Drug Codes, or NDC, to describe drugs. NDCs indicates the size of the package, the dosage formulation of the drug name, whether it's generic versus brand name, and the manufacturer. The codes are standardized by a National Council of Prescription Drug Program, and these 11-digit codes are found in the pharmacy files and are coded as the prescriptions is ordered. While specificity of NDC code supplies details information about the drug used in a facility, this makes data analysis difficult. So to address the issue, the American Hospital Formulary Services developed the Therapeutic Classification Group and System to categorize drug products. Pharmaceutical data may also be identified by RxNorm, and RxNorm is a name and standard for prescription and over-the-counter drug that is provided by the National Library of Medicine. So the purpose of RxNorm is to allow providers to standardize the naming convention and identifiers for drugs. Administration data is revenue codes, place of service codes, claim processing codes, and relative value unit data. Let's talk more about that. Healthcare data have several sets of calls that are used that are not related to disease classification or treatment method. These data sets are administrative data and or data that's created or collected through a registration or billing process. The three most common code sets are revenue codes, which are recorded on a hospital facility claims to assign services and charges to the department. Revenue codes is a 4-digit code that is used to categorize charges into a department on the UB form, what they call Uniform Bill -04, or a 837I billing record. They are not necessarily the same department found in provider's accounting system. So the codes also track Medicare revenue centers for Medicare codes rather for the Medicare cost reports, and categorize revenue by similar types of service such as radiology or lab. Each hospital provider have their own internal listing of departments used in their accounting system or in their general ledger. And these codes are used on professional claims to specify the entity or location where the services were performed. So take a look at revenue codes, and then also take a look at the place of service codes. And these codes are used on professional claims to specify the type of location that the service were performed. And I just spoke of that earlier. Let's quickly move on